So thanks for the opportunity to speak with you again and share this information with the wider community and the Territorians and those who've come here from other places. So as you've probably been aware, our HPPC and Chief Health Officers have been meeting every day over the Christmas period, including Christmas Day. And through that, the discussions that I've had with my colleagues around the country and my leadership team here, we started wide and sharp and hard and early. We've now adjusted the controls that we can put in place to keep Territorians safe from COVID-19. So because of that, there's an emerging cluster within the inner west suburbs of Sydney that poses some risk to the Territory. And I say that poses some risk. There is risk of travel from there, both now and also over the last recent days and into the future, where that virus could spread to the Territory. So it's an opportunity to remind people that the COVID virus has not gone away and that we need to approach everything that we do in terms of our gatherings and the activities. This time of the year, we mix a lot. We go to people's places and go to venues. And as you can see in Sydney, for those who monitor the media, there's been a lot of public health controls across Sydney, very strong controls in the Northern Beaches area about movement and the number of people, and a lot of controls elsewhere across Sydney, especially over the New Year period. But it is true that this emerging cluster, where there's a couple of mystery cases and some contacts, that until we can see where that's going, it's appropriate to declare those suburbs of Western Sydney, inner Western Sydney, a geographical area of risk to mitigate the risk to us. And I note that it's small numbers, but it's the uncertainty about where people have been and the spread that might have occurred and into the future over that New Year period that we do this. It's in a population, though, of around 5 million people. Wastewater testing from around Sydney and all up and down the coast and to the regional centres shows no positivity except in places where we know there have been cases, and now there is some positive testing in the wastewater in the Liverpool catchment area. That's to be further investigated by New South Wales Health. So I actually contact my colleagues very early in the morning, get lots of information from them about the testing that had been done but not yet reported. The conversations I have with my colleagues particularly about the risk to us and the controls they have in place. I talk to my leadership group, and that's to validate our approach. There's others who probably have an alternate view to this, but all I can say is we've taken the same approach, which is a principle-based approach with agile controls and appropriate proportionate controls since the beginning of the pandemic. As part of this, though, I think it's an important reminder to us that when people come here, we have certain requirements in terms of the principles and the venues that you go to, the activities that you take place in. They will have COVID management plans, and there's an expectation that people will comply with those plans. But those, the structured, organised ones, it's the gathering in small groups that poses the biggest risk. So it goes back to my principles that I've stated before, starting from the top, 1.5 metres, less chance, particularly if you're not facing directly towards someone. Use your own hygiene measures and make sure they use theirs. Be vigilant, absolutely vigilant, not to go anywhere if you have any symptoms. And some of the symptoms that we've seen again is loss of a sense of taste and smell, and even diarrhoea. That tells you may well be infected. So don't go out, stay at home and organise a test by calling the hotline. And the other one is our principle that we follow, that is remind people, mix with people you know well, work with well closely who aren't infected, and those who you share a house with. If you don't know people, then you could ask them respectfully to stand back or step aside, use the hygiene products that are available. So this is, again, the COVID virus hasn't gone away. The vaccine is coming. That's true. But this now, and it's clear that international travellers of all sorts will bring this virus back to our shores and to the territory. Now, we've remained COVID-free for the whole of this time in terms of community transmission. And I think all of us would like to keep it that way because we have a wonderful lifestyle here, but remind yourself and others about what the risks are. And I apologise to anybody that's impacted by declaring this. Either travel to Sydney and those places and even other places and travelling back from those suburbs. So thank you very much, and I wish everybody in the territory, those who live here and those who visit here, have a safe Christmas on the roads, on the water, and COVID safe as well. Thank you.